Hello, and thank you for watching the recorded version of our mid-year training for the School Health Services program. My name is Olga Genshin, and I work for the Department of Healthcare Policy and Financing. You may hear us referred to as HCPF throughout the presentation. HCPF is the state's Medicaid agency, and I am your program administrator for the School Health Services program. We have a list of acronyms here. Throughout the presentation, you may hear acronyms, and if you're not sure what that means, you can always go back and see what that acronym stands for. And we have an agenda here, lots to talk about, so I'll go ahead and hop right into it. Here's the Centers for Medicare and Medicaid Services Comprehensive Guide timeline. This is the same timeline that I presented at our annual training back in August, so nothing has changed here. But just a reminder that we did receive the new guidance from Centers for Medicare and Medicaid Services back on May 18th of 2023. That's been almost 2 years now, and it had been almost 20 years since we had received any new formal guidance from the Centers for Medicare and Medicaid Services. Since that time, HCPF has been analyzing the areas of the program where we're required to make changes. So we have been conducting that analysis this fiscal year and the previous fiscal year to try to figure out what changes are required in Colorado and what is going to work best for the Colorado program moving forward. Then moving into fiscal year 2025-26, HCPF is going to work with Centers for Medicare and Medicaid Services to approve those required changes to the PCAP. The PCAP is the document that guides the administrative claiming side of the School Health Services program, and the State Plan Amendment, the SPA, which is the document that guides the direct service claiming side of the program. And then after we get those mandatory changes approved by Centers for Medicare and Medicaid Services, that mandatory date for the changes that Centers for Medicare and Medicaid Services are requiring is that July 1st, 2026 date. But the thing to remember here is that we are operating according to current program manuals, current rules and regulations for the School Health Services program here in the state of Colorado. Nothing is changing at this time, so don't make any changes to the program. It is business as usual for now, and we will certainly incorporate those changes into any further training programs as we're moving towards that July 1, 2026 effective date. Here is a link to the CMS Comprehensive Guide. This is a live link at the top if you'd like to go and read through the entire guide. It is a little bit lengthy, it's about 184 pages long. As I mentioned, nothing is changing right now. You will be notified if anything changes with the School Health Services program. If you do have any questions, please contact me directly with any questions, especially if you are hearing something that's concerning. We definitely want to make sure that accurate information is being communicated. Please let me know if there's anything that you're hearing that's concerning, or if you just have a simple question regarding these changes. We do not anticipate any changes around direct service billing. We have a legislative requirement that we have to submit to the legislature once a year how many children are served by the School Health Services program in the state of Colorado. And we do that by extracting that information from the direct service billing platform, that interchange platform. So there are no anticipated changes around that direct service billing requirement because we do have that legislative requirement to report the children served to the legislature once a year. And we were really we're really ahead in Colorado with a lot of the program enhancements that CMS suggested. So where there are other states that maybe had a lot of changes to make, Colorado was really ahead of the game and were actually used as an example in many of the changes that CMS was suggesting. There are two areas where we are going to have to change, and that is that bus aides are not going to qualify for a specialized transportation trip. So the presence of a bus aide alone does not qualify that vehicle for a specialized transportation trip. The vehicle has to be modified in some way, and that modification has to be required in the student's individualized education program, their IEP. So the bus aid, if that is the only thing and there is no modification on the vehicle, it will not qualify. The trip has to take place on a vehicle with that modification that is required in the student's IEP for that trip to qualify as a specialized transportation trip. The other place that we are going to have to change according to the CMS comprehensive guide is that we are going to change the number of time study moments and the length of the time study. Exactly what that looks like right now, we aren't sure. Like I mentioned in the previous slide, we are conducting really thorough analysis to figure out what is the best structure of the time study for the Colorado's time study. National Provider Identifier Requirement. This is the requirement that all physical therapists, occupational therapists, and speech language pathologists that are on your staff pool list have to have their own individual Medicaid provider ID to be on your staff pool list. The district or Board of Cooperative Educational Services, that BOCES, NPI, is no longer valid in that field. For those PTs, OTs, and SLPs, they have to have that Medicaid provider ID for the individual provider. If they don't have a valid Medicaid provider ID, those services will be denied. Just a few reminders here about the billing requirements for the state of Colorado. For the School Health Services program, we do have a 120-day timely filing requirement. If those direct service providers are on your staff pool list, service documentation is required. So they still have to bill for their services for those individual services. This is a CMS compliance requirement. We have to have this requirement in order for school districts and BOCES that participate in the program to receive those federal matching dollars. So this is required. And the providers are considered unqualified if they don't have that individual provider ID and should not be on your staff pool list if they don't have that Medicaid provider ID. I would really think of this as very similar to the licensure that you look at before you put a direct service provider on your staff pool list. If the provider did not have a valid licensure, you would not put them on your staff pool list. And the same is true for that Medicaid provider ID and should be tracked really in a similar way. A little bit of a timeline here for how we got to this requirement full implementation. This was actually mentioned for the first time that the requirement was forthcoming back in August of 2021 during annual training. And we were able to buy some time by allowing school districts and BOCES to use their district's NPI in that ordering provider field to allow stakeholders to pilot the program and develop some of those best practices that were then shared with their member districts. So in August of 2023, all districts started enrolling individual providers. And then July 1 of 2024 was when claims started denying without that individual Medicaid provider ID. And starting with that October 1, 2024 staff pool list, providers could not be on the staff pool list without that valid Medicaid provider ID, those OTs, PTs, and SLPs. Here are some tips for everyone to keep in mind as you're navigating this process and this requirement for all of your OTs, PTs, and SLPs on your direct service staff pool list. There are step-by-step directions and FAQs in the NPI OPR guide. We are happy to answer any questions, but in that NPI OPR guide, there are FAQs, those frequently asked questions, that are the questions that we're receiving are often already listed in that NPI OPR guide. So if you haven't looked at it for a while, or maybe you've never looked at it, please take a look at the NPI OPR guide on the program manual website. That is a direct link on the slide here, and you can just click on that link to review that NPI OPR guide. One of the most common questions that we received is about affiliations, that affiliations are not required. So I would just go back and look at that NPI OPR guide, and it may answer some questions that you have had. You have to start with Gainwell at the provider call center to troubleshoot and get that provider enrolled in the first place. If you aren't getting anywhere with Gainwell, maybe you're not sure what next steps are and you've worked with Gainwell to try to resolve those next steps, please then email the School Health Services general email address, and that link is in that center box. That is the general email address that goes to both myself and Tracy, and both of us can help you with any questions regarding this requirement. The fastest way for us to help you is if you provide us with an application tracking number, that ATN. It takes us directly to the provider's application and we can see what's going on in there. It also helps if you send us a summary of the issue and the steps that you've taken to resolve that issue. And so it's sort of a help us help you kind of thing. If you can include that ATN and a summary, we do need a certain amount of detail. We can't look anything up or help you much if we don't have that detail. And it is also really helpful if you don't just send us a string of emails that we have to try to interpret. So thank you for providing us with that ATN and the summary of the issue so that we can help you as quickly as we can. Again, track those Medicaid provider ID expiration dates just as you would a licensure expiration date. That is going to be very helpful so that you don't keep a provider on your staff pool list if they don't have a Medicaid provider ID that's current. If their Medicaid provider ID has expired, you should remove them from your staff pool list. And please monitor the explanation of benefits for claims in interchange, and that's a direct link there as well. This is incredibly important because if there are issues with any of your claims, not just claims for PTs, OTs, and SLPs, if you are regularly monitoring those claims and interchange, you can catch any issues within that 120-day timely filing period. I do monitor those claims and I review them on a monthly basis. However, at that point, they have already passed that 120-day timely filing period, so it's too late for you to make any changes. If you're proactively looking at those explanation of benefits codes in interchange, then that will help you find any of errors that need to be corrected. Otherwise, your interim payments could be put in jeopardy if your claims drop or if they completely stop. So it's very important for you to monitor those in interchange. And that also means that you're looking directly in interchange, not your billing agent's billing platform, because a lot can happen between your billing agent's billing platform and interchange. And what really matters for this program are the claims that are listed in interchange. A couple of reminders: claims with invalid Medicaid provider IDs will be denied. And there are findings for unqualified providers that are assigned a random moment time study moment. That is not allowed. And you should not be claiming for any salaries and benefits for unqualified providers. And that includes one of these PTs, OTs, or SLPs that don't have a valid Medicaid provider ID. Here are some more billing and enrollment resources. The revalidation website at the top there has a spreadsheet that includes all of the providers across the state, their NPIs and their Medicaid provider IDs and their expiration dates. So that is a really valuable tool that's updated every Monday that you can review for those PTs, OTs, and SLPs at your school district or BOCES. It also has the district and BOCES revalidation date in there as well, and that is still required. So please keep an eye on that revalidation website and that spreadsheet so that you know when revalidation is due for your district or BOCES and also for your individual providers. There's a link there for provider enrollment training that happens about once a month. And I encourage you to go to that provider enrollment training so that you can help your providers as they are navigating this enrollment process. There's also a PowerPoint presentation that you can view that is also a really good resource to learn more about the enrollment process. Gainwell will be switching to Optum for the provider call center. That link will take you straight to a website on the HCPF website to explain which parts of the Gainwell contract have switched to other vendors. And Optum is the vendor for the provider call center, not for any of the other items, but they will be assisting with the provider call center. Thank you for the test callers that are going to be helping with the soft launch of the Optum Provider Call Center starting on April 1st. And they're doing that to make sure that the school health services questions are getting answered in an accurate way. And I also provided the Optum contract manager with a knowledge tool so that Optum knows of sort of the unique things that come along with the school health services program. Cover All Coloradans reminder: I sent an email to all coordinators back on December 2nd of 2024. Cover All Coloradans is a new program that just went into effect on January 1st of 2025. And you can look in the letter for more details, but just a reminder that because the Cover All Coloradans program is for pregnant people and children to get coverage under a Medicaid lookalike program, and that program is funded by state funds, state general funds, and CHIP. That funding those are both separate funding sources than school health services, which is a federally funded, federal matching dollars. So those funding sources are both separate. And for that reason, the Coverall Coloradans enrollments will not affect school health services reimbursement because, again, school health services is reimbursed through federal matching dollars, and Coverall Coloradans is funded through CHIP and state general funds. This will also not increase your transportation trips. Coverall Coloradans transportation trips will not be counted towards your transportation ratio. And the Coverall Coloradans enrollments will also not count towards your Medicaid enrollment rates or the IEP ratios that are both used in the formulas to calculate your reimbursement for school health services. School Health Services Program stakeholders, we have a group of experienced coordinators from across the state that help us with mentorship, they help us with training, and also they do things like help us bounce ideas off of each other. For example, with the new CMS Comprehensive Claiming Guide, we have been talking with our stakeholders about what is the best way to move forward with the mandatory changes as a result of this CMS Comprehensive Guide. Stakeholders attend our monthly mentorship sessions. I try to schedule a different stakeholder at every monthly mentorship session so that new coordinators can meet all of the different stakeholders, and they help us during training, facilitating breakout groups, and also with our more in-depth new coordinator training. Stakeholders are assigned to regions and they represent member districts in those regions at the stakeholder meetings that happen 3 times per fiscal year. Before each stakeholder meeting, I send out, on behalf of HCPF and CDE, an email to all stakeholders for topics that we're going to discuss at the upcoming meeting, and also just asking for stakeholders to get feedback on anything that their member districts would like to bring to the state's attention. So please keep an eye out for those emails from your stakeholders. They happen again before each stakeholder meeting that happens 3 times per fiscal year. We want to make sure that you are represented at each stakeholder meeting, and I know the stakeholders want to hear from you too. Make sure that your stakeholder's email address is added to any safe list that your district or BOCES has. I know that those security firewalls are getting harder and harder to get through, so adding your stakeholder's email address to your district or BOCES safe list will help make sure that you're getting any stakeholder communications. I'll also say here that you have your stakeholder representatives that help represent you at those 3 meetings during the fiscal year, but mentorship can happen in a very different way because all districts and BOCES operate very differently. They have their different policies, different accounting systems, transportation systems, human resources systems. And so I think it's important to really reach out to all the stakeholders, and you can do that on the stakeholder website to see what their areas of program knowledge are. Those are all listed out on the stakeholder website. And then that way you can receive mentorship or sharing of best practices by stakeholders who might have a similar accounting system or HR system at their district or BOCES. So while you have your representatives, mentorship can happen in a very different way. Here are your stakeholder representatives. Again, they are organized by CDE regions. And then we also have community partners. And right now, those community partners, stakeholders, are the 3 billing agents that are authorized in the state of Colorado. National Alliance for Medicaid and Education. We had a great conference here in Denver back in October of 2022. We discussed, and they had general sessions regarding that CMS Comprehensive Claiming Guide. There were general sessions by Centers for Medicare and Medicaid Services and the Department of Education. As usual, we always have a really great representation from Colorado. We presented at both breakout sessions and nugget sessions, all of which were very highly attended, and we have 4 members of NAME leadership. We were also tied for highest attendance. We were tied with California, which I think says something because California is just such a large state. And please save the date for the next NAME conference coming up in Philly in October, and that is the 7th through the 10th of October of 2025. And you can pay for NAME attendance through your administrative budget through your local services plan. And if you have any questions about that, you can, of course, contact CDE. Program resources, we have a robust program website and manual that we update at least once a year and maybe more often if there are things that need to be updated. We do have monthly office hours. These monthly office hours are for any district or BOCES staff that support administration of the school health services program. Also, again, please make sure that you're monitoring the interchange billing system on a regular basis to make sure that your claims are going through correctly. This is not only important for those PT, OT, and SLP services, but of course you want to make sure that all claims for the school health services program are going through appropriately, because if they aren't, your interim payments could be at risk, and of course nobody wants that to happen. Your contract with HCPF is also a great resource. The last fully executed contract was in fiscal year 2022-23. If you don't have a copy of your contract, please email the general email address, and we're happy to get you a copy of that contract with HCPF. And that really outlines all of the requirements that you're contractually obligated to continue participating in the school health services program with the state of Colorado. Of course, you can always call or email us. Please do try to use the general school health services email address so that if I'm out, someone else is able to answer any questions that you have. And then if you aren't signed up for our newsletters, please do that as well. We had a lot of really good feedback in our last stakeholder meeting regarding our newsletters, and our program website has a link to the newsletters, and you can sign up for those newsletters on the program website. I'm going to really quickly go over the outreach materials. These are the same slides that I've reviewed the last couple of trainings, so please just take a look at the slides that are uploaded on the website and find out which resources work best for the way that your district or BOCES communicates with families in your school district. Now, of course, this is important because we want to make sure that if families need health coverage, they get health coverage. So of course, with these outreach materials, you are helping families in your school district or BOCES obtain needed healthcare coverage. But it also helps with the reimbursement through the school health services program, because if they are eligible for Medicaid and they're a student at your school district, then that increases your Medicaid enrollment rate and your IEP ratio, which are those 2 ratios that are part of the formula used to calculate reimbursement through this program, through the school health services program. So take a minute to just look at all these materials that are out there. There are flyers on the website that you can customize. The renewals page itself guides members through the renewal process in both English and Spanish. Sometimes I will forward coordinators emails from insurekidsnow.gov. There are some great resources out there as well. There are appeals resources in both English and Spanish. And there are also resources so that as you are helping families in your school district or BOCES find coverage, if they are not eligible for Medicaid coverage, then you can find them some other coverage. Now, of course, if they're not eligible for Medicaid, that will not help your reimbursement through the School Health Services program. But if they are eligible for something else, that does help the family just secure coverage. And that's it for the HCPF portion of mid-year training updates. Thank you very much and have a great day.